Part 7. Running a test cassette from a fingerstick sample. Once you've set up the system by running the optics check and external quality control material, you are ready to run a test. You will want to have prepared the following items prior to performing the fingerstick: the test cassette, lancet, capillary tube and plunger, alcohol pad, gauze, biohazard container, gloves, and a bandage. Have the participants sit in a chair next to the table with the supplies. The National Cholesterol Education Program, or NCEP, recommends that if possible, blood should be drawn in the sitting position and the patient should be allowed to sit quietly for at least 5 minutes before sampling. NCEP also recommends that blood samples for a fasting lipid profile should be obtained following a 9 to 12-hour period of fasting. If necessary, the patient can take water and prescribed medications during the fasting period. The American Diabetes Association recommends that blood samples for a fasting glucose test should be obtained with no caloric intake for at least 8 hours. If an individual is dehydrated, it may be difficult to obtain a representative blood specimen, especially by skin puncture. Individuals to be tested should be well hydrated. As a reminder, medical gloves should always be worn when performing a patient test. Prepare the capillary tube and test cassette. The plunger can be inserted into the capillary tube at the end with a colored band, prior to or after collecting the sample. Be careful not to push the plunger past the stopper inside the capillary tube. If you do, a new capillary tube should be used. After the test cassette has reached room temperature, open the foil pouch and remove the cassette, placing it flat on the table. Please note, the foil pouch should not be opened until you are ready to run the test. Remove the desiccant pack and discard along with the foil pouch. Performing the test correctly is essential to getting accurate results, and this involves the following key steps. Prepare the test site. Collect the blood sample. Transfer the blood sample to the test cassette. Run the test. When preparing the test site, choose a spot that is slightly off-center of the ring or middle finger pads of either hand. The fingers and hands should be warm to the touch. You can help ensure adequate blood flow by rinsing the hand with warm water, by applying a warm compress to the hand for several minutes, or by gently massaging the finger from the base to the tip several times to bring the blood to the fingertip. Clean the site with an alcohol pad. Dry thoroughly with a gauze pad before performing the fingerstick. Perform a firm and deep puncture. Squeeze the finger to obtain a large drop of blood. Wipe away this first drop of blood as it may contain tissue fluid. Squeeze the finger again until a second large drop of blood forms. Do not milk the finger. The puncture should provide a free-flowing drop of blood. Hold the capillary tube horizontally or at a slightly descending angle by the end with a plunger. Touch it to the drop of blood without touching the skin. The tube will fill by capillary action to the black mark. Do not collect air bubbles. If it is necessary to collect another drop of blood, wipe the finger with gauze. Squeeze the finger again until a second large drop of blood forms. Fill the capillary tube within 10 seconds. Wipe off any excess blood from the finger and give the individual a gauze pad to put pressure on the puncture site until the bleeding stops. Here are some important tips to consistently ensure successful testing. Don't milk the finger. Milking the finger is squeezing the finger while pulling the blood towards the puncture site. This can cause interstitial fluid to get into the sample and potentially cause inaccurate results. Don't hold the capillary tube at an overly ascending or descending angle. This can increase the time necessary to fill the tube and may lead to clotting or an air bubble in the sample. Don't continue to try to fill the capillary tube if the fill time is more than 10 seconds, as this could lead to clotting of the sample. If a problem does occur, discard the capillary tube and collect a new sample. If an air bubble is noticed in the capillary tube, discard the sample and fill a new capillary tube. Air bubbles can cause a short sample situation where the test cassette may not be able to perform properly. Now that you have successfully collected the sample, you're ready to run the test. Open the tray of the analyzer by pressing Run. To transfer the sample to the cassette, first you must apply the sample to the sample well area of the cassette by pressing the plunger down until the entire sample is expelled. Dispense the sample towards but not touching the white filter in the sample well. The cassette should immediately be loaded into the analyzer drawer. Hold the cassette horizontally and do not touch the black reaction bar or the brown magnetic stripe to ensure proper functioning of your analyzer. Press the Run button to close the drawer and the test will start. Bandage the individual's finger at the puncture site and wait for the results. Be sure to dispose of all supplies contaminated with blood in a biohazardous waste container. As the test is running, the progress will be indicated on the display screen of the analyzer. When the test is complete, the Cholestech LDX analyzer will beep, and the result will appear on the display screen. The tray will open, and the completed test cassette can be discarded in the biohazardous waste container. If the Cholestech LDX analyzer is connected to its printer, the results will print at this point. Press the Data button to view any additional or calculated results on the screen, and record them on the patient result form if necessary. Depending on the test cassette, it may be necessary to press the Data button a third time to obtain all results. After a test has been performed, pressing the Run button once brings up the prompt to load a new cassette and start a new test. Pressing the Stop button will close the tray, or it will close on its own. Call the technical service team if there are errors in testing results or any other questions. Additionally, if any abnormal or questionable results are obtained while using the Cholestech LDX system, it is a best practice to run quality control materials to verify the system functionality.